Hi YouTube, Wayne here. I just wanted to do a quick video about my recent Achilles tendon rupture, or ATR as it's also known. I'm now into my second week of treatment. I want to say that you're doing something cool and exciting when it happens, but it's not the case. Basically what happened was I was playing with the kids, I felt it pop, which felt like someone had kicked me on the heel. Turned around, there's nobody there, which I think is a pretty standard response from people. Knew straight away that it was the Achilles. Just thought, oh shit, this isn't good, or words to that effect, maybe slightly more colourful. Being in my 40s, prime candidate for this to happen. I think they see the highest incident rate is between mid-30s and mid-50s in males. We went straight to the ER, which I think from when it happened to when we got to the ER was about 40 minutes. At the hospital they did the Thompson test, which basically they have you lie down on your stomach with your foot dangling over the edge of the bed, and they squeeze your calf muscle. If your tendon is connected, your foot will move a little bit, and this is because the tendon is pulling your foot up. Initially the plan was to do a non-surgical protocol, which I think is pretty standard nowadays, but I had some x-rays done that revealed that when the Achilles ruptured, it had pulled off some of the bone, so they decided that surgery was really the only option. I was first in hospital on the Saturday and ended up having surgery on the Monday, so I didn't have to wait very long. In the surgery, they reattached the tendon, they took out the piece of bone that had come off, and then they shaved down some of the other bone. So, show a picture. So you can see that that's the bit of bone that had come off, and then they'd shaved down some of this to make it nice and neat. Yeah, surgery went well. I think it took a little longer than they expected. After surgery, they put me in a big, heavy plaster cast. When they put you in the cast, they make sure that your foot is pointing down so that the tendon has the shortest amount of space to strengthen. I guess nothing's pulling on it. The next step after we left the hospital was to go back to hospital, get the cast taken off, get the wound checked. They're happy with the wound, it was all good. So that was good. Then they put a fiberglass cast on, which was way lighter than the other one. The foot is in the same position. Yeah, so far it's been going pretty well. Haven't had any pain. Hospital gave me some crutches, which just standard crutches. So yeah, nothing flash. I've been looking at like knee scooters. So maybe we're looking to getting one of those. It'd certainly be a lot helpful for going slightly long distances. And the crutches, they're quite hard work. Yeah, showering has probably been really the only issue. It's a bit of a process. So at the hospital, they recommended that you kind of wrap a tea towel around your cast, and then you put the bag over and sort of tighten it up, and then you go for your shower like that. I was quite lucky, got given one of these bags, so it's nice and thick, water can't get through there, and then at the top it has like a rubber seal, so you kind of put your foot through there, which is, yeah, initially it was quite hard to get down that far to get my foot in it, but kind of figured it out. And then this forms a seal, you pull it all the way up above your knee, so it just goes up onto the bottom of the quad, so it's nice and tight, and no water can get in there. And then the hospital also gave me like a shower seat, so kind of put that in the shower, and then you kind of back yourself in. It's a little bit awkward, but it works. Next step will be going back to the hospital, getting this cast taken off, getting the stitches taken out and the wound checked, and then I'm not sure if we'll go back into a cast or if they'll put me in a moon boot. I think I might be in a cast for a bit longer due to having the bone shaved down. Yeah, so we'll see what they say. That's next. Hopefully some people find that helpful. See you next time.